Good afternoon, everyone. I'd like to begin by apologising for not being able to attend in person today. However, I'm truly honoured to speak on this occasion and to celebrate ASIO's 10-year anniversary. Congratulations to all. My name is Dr. Rebecca Bosworth, and I currently work as an operational nurse manager for the South region of Justice Health and Forensic Mental Health Network based at South Coast Correctional Centre in Nowra. I'm also an early career researcher and previously worked at the University of Wollongong as an academic in the School of Nursing. During my time at UOW, I was introduced to Prof. ACIOH George, who quickly became a pivotal mentor in my research journey. I shared with Prof. George my observations of oral health disparities among people in prison, a concern that had stayed with me since my time as a registered nurse in correctional facilities and even earlier during my experience as a dental assistant. This passion for custodial oral health became the foundation for the work I do today. Through Prof. George, I was coincidentally introduced to Dr. Keith Heap, the Clinical Director of Oral Health at Justice Health New South Wales. This is a great example of how ASIO and Prof. George enabled collaboration between industry and academia. With a $20,000 UOW startup grant I had secured, we collaboratively established the Oral Health in Prison study, where we were exploring a new model of care from an interprofessional perspective. While our project team grew significantly, one of the highlights, and again, credit to ASIO and Prof. George for introducing us to policymakers, facilitating that connection and introducing us to the manager of research at the Ministry of Health Centre for Oral Health Strategy, who kindly became a collaborator on our project. As an ECR, ACIO's support was pivotal. Under the mentorship of Prof. George, I was guided in grant writing, project management, provided access to key consultants, supported to mentor and supervise interns and honours students, and connected with key stakeholders across academia, industry, and policy, enabling collaborations that could assist in translating our research into practice and policy. As an ECR, this was my first grant to manage, my first experience employing research assistants and supervising interns. Prof. George guided me through every step, supporting me when challenges felt overwhelming, providing advice on managing a research team, and helping me navigate any complexities. ASIO complemented this mentorship by hosting the project team on site, providing the opportunity to plan our research, meet in person, and collaborate closely. This hands-on support strengthened our connections, enriched the research process, and gave me confidence as a new researcher. The OHIP study has produced several key outputs, including a global scoping review, looking at the role of non-dental professionals in custodial oral health, which is under review, a successful Ministry of Health Centre for Oral Health Strategy grant, and also one of the key highlights was Prof. George facilitating our whole project team to present our study at the Ministry of Health Centre for Oral Health Strategy. Recognition of our work included featuring the project on the ASIO website and receiving an invitation to become a national affiliate, valuing our contribution and connecting us to a wider professional network. We have also had the opportunity to present our research at the Justice Health conference. Prof. George's mentorship has been central to my development as an ECR. Despite his own workload, he was never too busy to provide guidance, check in when things felt overwhelming, and connect me with key stakeholders across academia, health services, and policy. There are some mentors who cross your path and leave a lasting mark, and that is Prof. George. However, his generosity extends beyond me. He has mentored many ECRs, creating opportunities and nurturing professional growth. ASIO as an organisation embodies this same commitment to mentorship, collaboration and integration. They actively support ECRs by providing guidance, resources and networks that facilitate connections with key stakeholders and enhance research capacity. Through ASIO, I've experienced firsthand how an organisation can champion both research excellence and professional development. In closing, ASIO has been instrumental in my journey as an ECR, supporting me through mentorship, collaboration, funding, hands-on project support, and opportunities to lead students and interns. With Prof. George's guidance and ASIO's organisational support, I've been able to gain confidence as a researcher, lead innovative projects, build interdisciplinary networks, and contribute to improving oral health outcomes in custodial settings. Once again, I'd like to congratulate ASIO on an incredible 10 years of supporting researchers, students, and the broader oral health community. I'm deeply grateful for the lasting impact everyone at ASIO, including Prof. George, has had on my career. Enjoy the celebrations.